Hello, everyone. Thank you all for joining us today, early this Sunday morning. Just some quick housekeeping up top before we begin today's session. We are recording today's webinar, so if you would like to watch the replay, please reach out and we'll provide you a copy in the coming days. I also want to let everyone know that we will be taking questions in the second half of this call, so if you have any urgent queries, please leave them in the Q&A tab at the bottom of your screen and our panelists will get to them. All right, over to you, Dalia.
Good morning, everyone. And thank you for joining our webinar today. I know that's a very hard time for all of us, and especially for the HRs and the companies to accommodate all the challenges we still have in order to get through it smoothly. With that, I would like to introduce Samantha Hayes, our senior consultant for Middle East and North Africa, who will be taking you through the presentation.
Brilliant. Thank you, Dalia. So good morning, everyone in Egypt. So as Dalia said, my name is Sam Hayes. I'm based in Dubai. I've been in the region just under 3 years. So the report we're going to be going through today is managing people through employee benefit plans, specifically around COVID-19. So this report will be available to you all from tomorrow. Your client executives will be emailing it out. So for the first part of this presentation, I'm going to be highlighting some of the risks that we feel that HR and businesses should be aware of. We're then going to have a poll, so a bit of an interaction, and then we're going to go through the solutions. So we really want to give you some practical advice and some practical solutions of how we can help. So thank you, Arun. So the first part of this presentation is the 8 risks that we feel are current within some companies. Now, as I go through this, you might only have 1 or 2 of these risks that you're aware of, or you might have some more. So the first one we're going to talk about is business disruption. So business disruption, you might automatically think as a stop of production, loss of products, kind of the factory sort of stopping. But what we talk about in people risk is really understanding the people and what has been happening to your staff. So for some companies in the early stages of the pandemic, the response stage, you unfortunately might have had to let some of your people go. So sadly, you might then have a shortage of staff. For other companies, there might be a reduction in pay. So for some of you, you might have had to cut pay by 20, 30, 50%. And for others of you on the call today, you haven't had to do that. So now most companies are kind of within the recover rebound stage. So kind of slowly going back to normal, slowly going back to the office, the new normal. What has happened to your people? So for some clients on this call, they're going to be going through a rehiring process. So they're going to have to start attracting talent to come and work for them. For others, they might be rehiring people that they let go. And for others who luckily haven't had to let anyone go, it's how do we keep our current population happy and engaged? So it's all looking about your people strategy. So what type of employer do you want to be? Do you want to be the employer of choice? Do you want to be that one company that people in your industry really want to go and work for? And controlling and advertising and engaging your benefit plans is a really great way of doing that. Employees nowadays know that it's not just about the salary, it's not just about cash, it's the full package of their employee benefits. And they want to ensure that the benefits are fit for purpose, above market norm, and really an attraction tool that you can utilize to your great advantage. So that's one thing you might be thinking, are our benefits up to standard? Can they be utilized to attract certain staff? Can they be advertised to promote and retain our current staff? So for some of you, that might be conversations that you're having or topics that you're thinking about. The second risk is about low productivity and poor performance. So again, within the early stages of this pandemic, you might have realized that your benefit plans weren't fit for purpose. Maybe there were exclusions that you weren't aware of. Maybe there were certain benefits that were really below par. For some clients, they might not have had enough, say, psychiatric benefits, so therefore mental health might not have been adequately supported. Some people might have become disengaged. Like a lot of clients, you've got people working remotely. Originally, we probably only thought this was going to be for a couple of months, few weeks at max. Some of us, it's now sort of 4 months, could be rolling on to 5 months. So again, how do we keep the employees engaged? How are we communicating? Sort of what is our communication strategy? Secondly, another risk we have identified is the unexpected financial risk. So this is kind of really talking into how has our behavior changed? How's our risk profile changed? So how has it changed from now, 2020 versus 2019? So we know under medical plans, there's probably a lull, a low utilization within the medical scheme for general outpatient visits over the last couple of months. During lockdown, we were encouraged not to go to the hospitals, not to go and see the doctor for minor things. So there's probably a slight reduction in our utilization there. But now, with lockdown easing and sort of hospitals and facilities opening up, are we suddenly going to see an increase in medical claims that historically we would not see these spikes? So again, what is happening to our data? Within the life schemes, we might have again have had a change in behaviour. So under the disabilities, have we had any more claims for the total temporary disability? Have we had people that unfortunately may have gotten COVID that have been off work for a couple of months? Maybe they were in hospital, maybe they were in intensive care unit. So was there claims utilisation or claims experience under that disability claim? And unfortunately, for some clients, we are going to see a spike in the death claims. So again, is the experience under the life scheme suddenly different to where it was historically last year, the year before? So again, it's understanding the behaviour. Is it a one-off? Is this a new trend? Is this a new behaviour of your company? So again, that's something that might be considered. And then finally on this page, we've got the rising costs. So we know, obviously, within the Middle East, we are linked to medical inflation. So global medical inflation is running at about 9.7%. Within the Middle East, roughly around 13 to 14%. Egypt is slightly higher, sort of around 17, 18%. So how will that affect our clients at the renewal stage? We know that medical inflation is linked to inflation. And we know that inflation is linked to the stock market and the global economics. We know that currency is affected by that. So obviously in Egypt, we had the decurrency of the Egyptian pound a few years ago. Let's hope we don't have that again. But again, it's all linked to the dollar, so the US dollar, the price of oil. We know that insurers and their reinsurers, that is how they are financed. So again, what is happening on a global level that affects us within the Middle East, that affects us within Egypt? So again, that's probably a risk that the business might need to be made aware of. We've also then got the damaged reputation. So this is kind of two parts. The first part is the external reputation. So for some clients, what have they done over the last few months that the general public now views them? Have you had to let people go? Have you been involved in any sort of social responsibility work? What have you done that the general public is now going to view you? Are they going to continue to use your services? So that's one aspect of the reputation, the external one. But one thing that we're concerned about is the internal reputation. So again, how do our employees view the company? Have I been looked after during this period? Have I been involved in the conversation? Am I aware what's happening within the business? So again, it's that continual communication, that continual thought of, am I being cared for? Am I being looked after? And it's that whole engagement piece that we kind of talk about within this report. Sixthly, we talk about safety incidences and volitations. So when we think about this, we've been in isolation, we've been working from home. I don't know about anyone else, but I'm constantly looking at my computer. I seem to have back-to-back Zoom calls. So how's that affecting my general body? So my eyesight, again, I'm looking at a computer screen day in, day out for hours at a time. I'm actually working longer hours because you kind of don't have that break between home and the office. So what's happening to my sleep pattern? Personally, I'm not sleeping great. And again, there's new studies coming out saying that sleep patterns have been affected because of isolation, lockdown, lack of social interaction, and kind of constantly looking at a screen. So if that's affecting my body, how has my behavior changed? So again, things that businesses need to be concerned about is employees. Are you making mistakes? Are you answering emails? Are you answering the phone in the same manner, the same high consistency as advice? Or are you being affected by being tired, sleep deprived, lack of energy, maybe poor nutrition? Children are at home. So again, how has sort of the e-learning, the remote school work affected you sort of within the home? So that's something else that clients need to be aware of. You've then got the compromised data privacy. So again, kind of twofold. One, as a business, how can the IT help support, prevent data breaches? So we've all been reading the newspapers and we're quite aware that scammers very much risen. So again, it's the phishing emails, it's the Trojans. How secure is my home Wi-Fi? So again, I'm using a home Wi-Fi rather than an office Wi-Fi. I'm not plugged into the system. How is that affecting it? So again, are we taking into consideration computer experts, cyber security, as well as the hardware of our laptops? And then secondly, if I am sleep deprived, if I am sort of not on the top of my game, how is that affecting employees in terms of making mistakes? So again, the stats here, 90% of data breaches is due to human error. And human error could be due to tiredness, disengagement, general wellness, sleep deprived, stressed, mental health. One big thing that we've seen within the Middle East is that mental health is really being a topic of conversation. A few years ago, even pre-COVID, it was probably still a bit of a taboo. But being isolated, human nature is not designed to be isolated. So how has that affected us? We've seen rises of stress, anxiety, depression. Very, very unfortunate for people that are going through those situations. So how is the company, how is the business supporting employees that are naturally going to be going through these mental health issues? And we know that mental health is led to physical health. So again, if I am stressed, if I have got depression, could I be getting ulcers? Could I be getting gut issues? What about my general mood and sort of my interaction then with clients? So again, mental health is definitely linked to physical health, which again is sort of part of something that companies need to be aware of. And then the final risk that we've highlighted is regulatory penalties. So again, Middle East, very, very highly regulated. So as an HR community, one of your main sort of objections is to ensure that the company is not at risk. Are you following the correct legislation? Is the benefits that are in place, are they aligned with any changes to recent legislation? So they are the 8 risks that we have identified within this report. And again, some of you might be going through lots, the others maybe just a handful, but something to consider. So we're now going to go through the live poll. So this is now going to be the interaction part. So if you can just vote, I'll read out the question. What do you consider as the key driver for health and benefit plans within your organisation? Improving workplace safety, improving employee morale and engagement, improving productivity and job performance, attaining and retracting employees, complying with legislation and reduce litigation, promote corporate brand and imaging, and containing cost. So if you can just answer one of those, that would be great. Brilliant. So we're going to show the results of that poll in a little while, in a couple more slides. But one thing that we wanted to share with you is the results of a recent survey. So this was performed in January, so very much sort of prior to the major COVID-19 sort of lockdown. So this is a health on demand survey that we conducted with our clients within the Middle East. And we asked them, what are the three main, so for the decision makers, what are the three main objections that is part of your health and well-being strategy? So coming in first was improving workplace safety. Coming in second was improving employee morale and engagement. And then third, we've got improving productivity and reducing employee absenteeism. So that was sort of pre-COVID. So again, very much sort of health and safety. We don't want our employees falling over. We don't want them having sort of mental health issues. Like, we're concerned that they're looking at computers and sort of all of those general workplace safety. Morale and engagement, again, great seeing that that's sort of coming in second. So again, how can you use your benefit plans to really promote the company, to ensure that we're showing empathy, that we're listening to our employees? So that came out in second. And then third was about improving productivity. So again, we know that a healthy workforce is a productive workforce. So that link is kind of established. So how do we join the dots? How do we get our employees healthy and productive, which ultimately improves business stance? So these were the top three drivers. And then towards the end of the presentation, we'll see if that's changed for Egypt. So now what I'm going to be doing is going through the 8 practical steps of what you, the HR community, the risk managers, how you can mitigate some of those earlier risks that we've highlighted. So coming in at number 1, we have got supporting the workforce, keeping them healthy, engaged, and productive. So every company wants to do this, but how can you do it? So as I've kind of mentioned, there's some new employee benefit trends that have really come out of COVID-19 since the lockdown, since we've got to work remotely. The big one is probably the virtual care. So this is your virtual GP. It's your digital medical support. So it's your doctor on the phone. So what are companies doing? Are they utilizing it? Even in lockdown, people get sick, the body gets ill. So how was the companies helping and supporting those employees? We know that hospitals and clinics were definitely disencouraging people from sort of generally turning up at clinics, the standard sort of outpatient. And we know in Egypt, that's kind of still going on at the moment. So how do we support the employees? How do we support their dependents, their children, when they get ill? Digital solutions is definitely the future. It's remote. You can do it from the comfort of your home. If you're back in the office, you can go into a quiet room and you can have those one-on-one conversations with the doctors. Some solutions that I've looked at for some of my clients, medicines can get delivered. So again, it's being linked to the pharmacy there. Secondly is about mental health. So as I mentioned, the taboo of mental health has slowly started to be eroded because of this lockdown. I think everyone is now aware, being in isolation, being non-social, not interacting with work colleagues, with friends. For some people, they're lucky they've got family at home. For others, for maybe your younger workforces or maybe some of your expats, they're living alone. So if you're not interacting with people on a social, how does that affect you? Are you seeing moods drops? Are you seeing anxiety? Am I going to get COVID? Am I going to get ill? What's happening to my family? What about finances? Depression? Are we ever going to come out of this situation? All of these things people probably would have gone through. So again, as an organization, as a business, how can we support? we're not mental health experts. So where can we direct them? Where can we kind of push them to seek appropriate medical support? So an employee assistance program is the best solution. It's an independent, confidential helpline. Employees, dependents can phone up and seek that mental health support. There's counselling sessions. You can do it WebEx. You can do it over the phone. You can do it Zoom. Post-COVID, you can obviously then do it face-to-face. So again, it's confidential. It's offering that support. So instead of someone maybe taking a few months off work, getting signed off with depression or anxiety, let's offer them some support. So that's kind of the EAP. As well as that solution, I think the conversation needs to change. The culture needs to be open. It needs to be accepting. A big thing that we're talking about within the HR community is about empathy. Individuals want to be seen as an individual. I'm Sam. I don't just want to be seen as a number. I want to know that my company cares about me. What am I going through? And I want to know that I can have that conversation, that there's not going to be any negative side effect for me having that conversation with my manager, with HR teams. So again, it's creating that safe, open environment. And sometimes that comes from top down. So again, it's getting the wider business involved. That's generally how we see great mental health support within clients. And then finally, it's well-being solutions. So well-being isn't just mental health and physical health. I've talked about those two quite a lot. It's also a broad spectrum. Financial health. So what happens if some clients have had to do reduced pay? What if I'm in debt? How do I learn how to budget? So the financial aspects of things. You might have community wellness. So again, some of our clients are doing movie nights together. They're doing quiz nights. They're meeting together, not just on a business side, on a social side as well. And then you've got the spiritual and the religious. So again, there are many aspects to well-being. And as a company, as companies, we're definitely seeing that trend as the employees trusting their employers. So what the employers put out, they will generally trust it. So again, what support are you offering? Another thing within this sort of supporting and engagement is, what do the employees value? Companies spend millions and millions of dollars, sometimes hundreds and thousands of dollars on their benefit plans. But what do people really want? So where's that gap analysis? So it's what you offer as a company versus what the employees believe they have. So again, that's sort of part of it as well. Secondly is choosing your suppliers carefully. So one thing that we've been talking about a lot through COVID is it covered? Is it excluded? Have the insurers covered it? Have they made general exclusions? Have they changed their stance? This is very much a fluid conversation. So how open, how communicative are the insurers? Another thing we're talking about is sort of the security and the safety of the insurers. So again, the last thing we want as your consultants is for certain insurers to go into liquidation. So how secure is that insurer? How secure is that HMO? Another thing around flexibility is maybe you might need to have conversations about payment terms. How open is your insurer to have that conversation? So maybe you need it to be a 90-day payment term rather than a 30-day. Maybe you need certain exclusions to be covered going forward. So again, how is the insurer interacting? How are they adapting to this solution? Thirdly, we then talk about communicating effectively. So again, some clients have been excellent in this, and I've had numerous conversations with clients on their communication strategy. They regularly update, maybe sort of once a week, once every 2 weeks. They're letting the employees know what's happening within their business. They're engaging with them. They're including them. They're making them part of the conversation. So what we did, quite interesting, is that during March, we actually asked some questions to our clients with the Mercer Talent All Access Spot Survey. And we asked our clients, those that have telemedicine, digital health, how often do you actively engage in the communication of this facility? So by that, we mean not just at the renewal and one communication, but maybe once every couple of months, once a quarter. How are you reminding employees that you've got this great service? Only 18% of our clients that offered telemedicine regularly updated their staff that they had this facility. So again, 82% of clients are only maybe engaging once a year. But we know communication needs to be done regularly. Maybe you've got a new employee that missed that renewal conversation. Maybe you had someone that was off sick or off holiday. So maybe they just didn't really catch it. And as we know, people need to be reminded sort of a few times for it really to sink in what they've got. Slightly higher percentage, so those clients that offered the employee assistance program, only 24% of them again actively engaged in reminding their staff that they had it. So again, we've talked about mental health. We know how important mental health and offering that support is. So 76% of clients, the 86% of clients that do have it but don't regularly engage, why not? So what's kind of stopping you? So again, maybe relook at your communication strategy and sort of what you want to achieve. What we also are talking to some of our clients about is centralizing decision making. So pre-COVID, typically it was mainly HR and procurement that were involved in that renewal conversation. What we're starting to see and starting to understand is that maybe this is a wider conversation. So as an HR community, who else should maybe be involved in this conversation? So taking a step back, what is the risk profile of the business going to look like in 3, 5, 10 years? What's our talent pool going to look like? What's our retention going to be looking like? What's our overall risk business strategy? So maybe involve other people, maybe involve people from finance or people from the board, health and safety people. Involve other people because the conversation will evolve, it will change, it will deepen. So that's another thing that maybe you could consider. Maybe have a well-being strategy. Get employees to be part of that community. So again, things would involve, you're engaging with your staff, you're keeping that communication line open. Next slide, Arun. Brilliant. So fifthly, we're talking to our clients about having a risk register for employee benefits. So this is kind of twofold. So one is, where is everything stored? So again, as an HR community, where are you storing the literature, the network list, the exclusion list, how to claim, phone numbers? Where is that being stored internally? Do employees know where it's being stored? Is it easy to access? So again, we don't want employees coming to HR asking these basic questions. You've got enough on your plate as it is. So again, maybe review what you're storing. Is it accurate? Is it up to date? Is it the latest versions? And check that. And then another thing we look at is kind of, well, what have we got? So have we got anything that's dual insured? Have we got something that's insured under the medical plan and under the life plan and maybe under the workman compensation? Are we paying for things that we really don't need? So again, evaluate what you've got. Do the risk gap analysis and understand how can we then spend the optimal solution on what we really need. Let's stop dual insuring. Sixthly, we talk about reviewing your benefits regularly. So for some of the conversations I'm having with clients, they're saying, well, we reviewed it last year. But again, my response is, the world isn't the same. So maybe last year you wanted to be mid-market. You just want to be in the middle. But again, you might have had to let people go. You might be on an attraction drive. Has your employee benefit strategy changed? Do you want to be that employer of choice? Do you want to be that one company within the industry that when people are looking for jobs, they automatically think of you, that you are offering that best solution, the whole package? So again, things might have changed. The world has changed. So has your employee benefit strategy changed? It might be maybe we had exclusions that we need to get covered. Maybe we have benefits that are being underutilized. So can we get rid of those? So again, it's a very broad conversation, but it's a real deep dive of your benefit plans. Number 7, we look at risk finance optimization. So this is kind of taking the contract into account. So majority of clients are going to be under a fully insured contract. But a lot of conversations I'm having with sort of global clients are around the change of risk appetite. So do you need to be looking at global pooling, captive arrangements, global underwriting, different changes in payment terms, deferred billing, cost sharing? So again, it's looking at the contract, it's looking, I suppose, at the pure risk of insurance and just saying, is what I'm on, is it still fit for purpose? Is it still what the business needs now coming, hopefully, towards the end of COVID-19? And then number 8, we look at the secure transmission of private data. So again, a very big topic within the world at the moment, linking back to cybersecurity and hacking, is how secure is my personal data? So as my employer, they do have a certain responsibility. So how secure is the insurer's security network? How secure is it internally? So the solution that we have is something called Darwin. So Darwin is our virtual platform that's used as an engagement tool. It's used to pass data. It's used to add dependence, remove dependence, pass communication on. It's also then used sort of in the future as a flexible and voluntary benefit platform as well. So one thing that we've kind of seen within this pandemic is the need for tech. So I was on a call with the head of Darwin a couple of days ago, and they were saying there's no such thing as a tech industry anymore. Every business has to have tech within their business because, again, you've got the Generation X, you've got the millennials, they're within the workforce now. They've never not known the internet. Everyone has smartphones. So how is that working with the business sense? How do I need to ensure that the employee benefits, the HR experience, the employee experience, how is that being moved into the future? How am I being employee centric? So how am I treating my employees as individuals rather than sort of the en masse? They want to personalize it, and digitalization is sort of the way forward. So they're the 8 solutions. So we're now going to have the results. Brilliant. So as a quick reminder, what do you consider as the key drivers for health and benefit plans in your organization? So coming up first was improving employee morale and engagement. So if you remember from the global study pre-COVID, that actually came out second. Within Egypt, it's coming out first. So again, I think everyone is fully aware we have to keep our employees engaged. They are vital to grow the business, to recover from this lockdown, from this COVID-19. So how do we make sure that they're healthy, they're happy, they're productive? That is, again, a big aspect of the HR community. Coming in joint second is improving workplace safety. So that's down from 1 in the global study. And then also in joint second is attracting and retaining employees. So again, depending on what your business had to do in the early stages of the pandemic, either let people go or keep them, we've realized that we have to hold on to our staff that have remained. We have to then attract the new talent, because there's a lot of talent out there. So how do we get the best quality? How do we keep our best quality of staff? So again, really great to see. And then coming in 4th is then improving productivity and job performance. So again, it's linked to the morale, linked to the engagement. No votes for cost. Again, always really interesting, coming up to pre-renewal conversations. So that's great. So go back to the presentation. Brilliant. So the final live poll, did you find this webinar and information shared to be valuable to you and your organization? So yes, I would like more information, thank you. Somewhat, or no, I'm not interested in this information. So please vote how you found if this was informative or not. Okay, so while you answer that, just very quickly, so the report, Managing People Risks Through Employee Benefit Plans During COVID-19, this is now live. So your client executives will be sending this out to you this week. It's a 15-page document. Everything that I've already spoken about sort of over the last half an hour is included within it. So please feel free to use it. It's a great business case. It's a great topic, a document to use with the wider business to highlight that these could be some of the risks that the business is experiencing and how you as the HR community, how you can help through the benefit plans. So thank you, Arun. So we're now going to have the results. Brilliant. So 75% said thank you very much, that yes, it was informative. 2 said somewhat, and no said no. So thank you very much for that. So I think we're now in a stage to take Q&As. So we haven't had any come through in the presentation, but if you'd like to ask any questions, myself and Dalia are here. So we did have a question that came in prior to the webinar. So Dalia, a question that came in: how do I go about ensuring workplace safety for employees returning to the office and managing anxiety around this? What if some of my employees are uncomfortable to go back? How would you answer that?
Sorry, I didn't hear that question well. Can you repeat it? Sorry.
Of course, Dalia, sorry. So how do you go about ensuring workplace safety for employees returning to the office? And what if some employees have got anxiety about returning back and they're feeling uncomfortable?
Yeah, I think that we face the situation really in Egypt here. And most of the clients, they raise this issue because the situation is not stable in Egypt, that they opened everything and we have to return back to the work. And at the same time that the situation is not stable for the hospitals and for the government hospital and private. And also we have many cases. That's why I think that the employees, they are frustrated whether they can go back to the work or not. I think, yes, this is a real situation in Egypt. That's why I think we have to work on the coverage of the employees and to inform all the employees that they are covered and to confirm and on the benefits and everything, and we can do an orientation for the employees to know that they are covered, and if not, because it's not the COVID-19, it's not covered with all the insurers in Egypt, so we can find a solution for the clients which they are not covered with the insurance company.
Brilliant. So it sounds like it's communication, like things change. Legislation change, the COVID-19 situation changes. So clients just need to regularly update when things are changing.
Yeah.
Yeah, brilliant. What about the anxieties? What about if some employees are kind of scared to go, if they're allowed back, but they're scared to go back? Sort of what conversations are you having about that?
I think we have to be clear with the employees and to advise them about the active situation, and to advise them that the company will help you under any situation. I think this is the most important thing, that they want to feel that there is a support from their company.
Yeah.
Not for the employee only, but for his family also.
Yeah. It's the whole empathy, it's the looking after, it's the feeling like you're part of the company. Yeah, it's that continual engagement. So yeah, brilliant. We haven't had any Q&As yet from anyone, but if anyone does have any questions, please feel free to write it down. So we had another question here. So what can we expect from future ways of working, and how can we prepare our workforce for the new normal? So I suppose some conversations that I'm having with my clients is looking at wider HR policies. So pre-COVID, probably flexible working wasn't really a big thing for a lot of companies. But now some of our clients have had employees working from home for 3 months, 4 months now. There might be a change in attitude. So you might have some employees that have young families that actually quite like being home, looking after the children. So maybe working from home, flexible working, that might be an HR policy that's kind of being looked at by some companies. We've then got sort of the new normal. So what does the new normal look like? For some clients, it might be, you might have had some salespeople that traveled around the Middle East, but how in the future, how much travel is going to be done? You might have been doing some sales pitches where you would go and send your people. So again, maybe that's something that sort of the HR community might be thinking about is what might change? How might this lockdown sort of affect day-to-day working of people? So Dalia, we had one sort of more question is, how can I manage the cost of medical insurance for my employees?
Okay. It depends on the companies here in Egypt. Actually, most of the clients here in Egypt, they are okay with the payment and with the cost. Some of the companies, they thought about reducing the cost and reducing the benefit. Not reducing the benefit, but to review their benefit. For example, maybe there is some benefit they are not important during this time, and there is another benefit that we have to enhance on it. For example, we face now the high cost to cover the COVID-19, which need to have a high annual ceiling to cover it, because the accommodation in the hospital became very high, very expensive. So we need to enhance the ceiling, the annual ceiling. And at the time, we don't need to enhance the benefit of the optical and dental. We can reduce this benefit and the limit for this benefit, and the impact of this luxury benefits here in Egypt, they have a very high impact on the premium. So we can review the benefits for our employees, and we can enhance in the needed benefit during these circumstances or during this situation, and we can not cancel, but we can reduce the other benefits, the luxury benefits here.
Yeah. So it's kind of like a balance. So
Yeah.
What do we need to enhance? What do we need to ensure is covered versus what can we reduce? So sometimes it might not even be remove. It could just be maybe say reduce the benefit slightly. You might have a very benefit rich plan, but it's not being optimized. It's not being used. So yeah, you can reduce that. Yeah, brilliant. What other conversations are you having with your Egyptian clients? Are they sort of looking at their communication strategies and how they engage?
Yeah, most of the questions and the discussions here in Egypt about the well-being and the wellness, and because this is the wellness and the well-being is not familiar here in Egypt, and the employee assistance programs, it's not familiar here in Egypt, and it's not covered with the insurers. And because of the situation now, all the clients I asked about it. But I think that the good side of the COVID-19, that all the insurers, or not all the insurers, most of the insurers, and especially the multinational insurers, they're thinking now about the coverage of the wellness, and to provide more programs for the clients, and to cover the employee assistance and the health mental programs. I think this is the good side of the COVID-19, that during the coming period, there will be more benefits and extra benefits for the client that will be provided by the insurers.
Yeah. So you're kind of seeing the insurers adapt, evolve. What else can we offer? They're kind of trying to improve their services.
Yeah.
Yeah. Brilliant. So thank you very much, Amar. We've had a question. So due to the COVID-19 crisis nowadays, the continuity plans for most of businesses become unclear and undefined. I'm asking about the direct strategy rules for HR professionals inside their corporates to ensure that we're doing the best that we can do. So thank you, Amar. So I think this probably goes back to the beginning of the presentation. So when you get this report, you've got the 8 risks. So again, read everything through and go, what are my risks within my business? And you might have 1 or 2, you might have 6 or 7. Then go towards the second part of the report, and then it gives you the solutions. So you might have a morale issue. You might have noticed sort of a drop in productivity, a drop in sort of outcome from employees. So if that's your problem, the solution is then engagement. So how do I engage? How do I communicate? How do I tell them the great benefits that we've got? You might have a problem with working from home. You might have people that are feeling really depressed. You might have people that have maybe got back problems. So the solution might be, well, how do I promote an EAP? How do I get some community engagement? How do I sort of personalize what I'm telling my staff? So again, it's kind of identifying what your risks are and then finding the solutions. And obviously, our client execs, Dalia, is here to help with any of your questions that you might have. Because again, every client is different. Every client's got different risks. Your businesses are different. You're going through different stages of the pandemic. So please reach out to us and start this conversation. Yes, Rami, the recording of this will be available. And if you have got sort of wider people within your businesses that are really interested in this and sort of one-on-one conversation, please let myself and Dalia know about that. So that's great.
Yeah.
So I just wanted to say thank you very much for your time this morning. I know it's sort of early on a Sunday, so thank you very much. I do appreciate you taking the time out to listen.
Thank you.
Brilliant. Thank you very much, everyone.